They don't want to see how well you can diagnose. They don't want to see how much information you have mastered or how much information you have crammed or all of that. No. Your logic, your ration, your clinical judgment, your clinical thinking, your chronology. Even if your diagnosis is wrong, how did you come up with that diagnosis? How did you arrive there? That is what they want to know. And if that reasoning is correct, then no, even if your diagnosis is wrong, everybody gets wrong diagnosis. That is a sure fact. Everybody gets wrong diagnosis. But even if your diagnosis is wrong and your clinical and logical thinking is intact, you're definitely going to make it during that examination. Hi guys, my name is Bonsai Danilo and you're welcome to another edition of Danilo Reacts. Yes, I know it's been long. I've made a video. That's because the whole of last academic year and the beginning of this academic year has been hella busy for me. So there was practically no way for me to make another video. But hey, here am I making another video. I have some time at my disposal now. So you'll be getting some content from me. So stay tuned and watch out for this space. Anyways, so last year I was in my fifth year in medical school. Like maybe most of you know, I'm a medical student in the University of Boya in Cameroon. So I was in my fifth year in medical school last academic year. So this video is basically going to just be highlighting my experience in fifth year, and hopefully my experience helps someone out there. So basically at the beginning of the year, you'll be expected to do 4 rotations: internal medicine, surgery, obstetrics and gynecology, pediatrics, and then you also have class courses that we normally do in school. While we are doing our rotations, we still have class work to do. So basically it depends on the program that the university provides to you people, maybe during your own year. In our own year, we had the first semester where we had 2 months. No, we had a month in school where we did, during the first semester we had a month in school where we did all our class courses, we did all our coursework, we did everything, and then we went to the hospital and did the clinical rotations. At the end of the semester now, you write the classwork, you write the clinical, not the clinical exam, the theoretical exam, the classwork, normally the courses that the university offers for clinical students, written courses, that's still surgery, obstetrics and gynecology, pediatrics, and internal medicine. We'll write class courses for those ones at the end of semester, at the end of each semester. In the second semester, we didn't do that. We were going to the hospital and coming back to class at 2 and having classes, and then retiring back to our homes at maybe 6 p.m. or 5 p.m. on a good day. So you can guess that this is really very stressful. So at the end of the second semester, we'll write our class exams like we usually write, but now this is already also the end of the academic year, so we're also preparing to write the MD exit, which, yeah, by the way, is very hectic. Now the MD exit is it's a very comprehensive clinical exam that is being organized by the university in order to test the clinical skills of fifth year medical students. If you have been opportune to be talking to have spoken to any medical practitioner or any doctor being trained in Cameroon, they'll probably tell you that the fifth year is like the rate determining step in maybe a chemical reaction. Like the fifth year is when you gather or you amass the amount of knowledge that will probably help you throughout your medical career. Like the fifth year is that year that actually determines what you will be as a medical doctor, what you will become in future, what you will be as a fifth year, what you will be as a sixth year. It's like a solid foundation that you build. So this clinical examination that you write at the end of the fifth year is very concise, it's very rigorous, it's very targeted, and it's gauged at actually testing your clinical skills after acquiring all of this knowledge from first year, second year, third year, fourth year, and now in your fifth year. Because when you go to sixth year, you are practically almost a medical doctor. But before you become that, the university obviously needs to test and see whether you're good for the sixth year, and you're good maybe subsequently to become a doctor and practice in Cameroon, and why not the rest of the world. So the exam, what is it made up of? We'll do clinical rotations, in all your four rotations. Now during the examination proper, it's a dedicated week where the exam is programmed, where you have maybe on your first day you might go you clerk your patient in surgery, the next day you do internal medicine, the next day obstetrics and gynecology, the next day pediatrics. Depending on your own program, a different person might have a different roster. So lecturers and professors from all over the country, usually the university usually invites lecturers from all over the country, like University of Yaoundé, University of Douala. They always send some of their professors and lecturers to come and also assist in the evaluation, and also international lecturers from University of Ibadan in Nigeria usually come. So validating this exam is like a standpoint to tell you that, okay, truthfully, if all these people could come and evaluate you and you pass, then rightfully you're on the right path, and yeah, truthfully you can actually become a medical doctor practicing anywhere in this world. So yeah, so how then do you prepare for this examination, which is very rigorous, which you need to pass, because you don't want to be coming for a receipt, because a receipt is practically an only chance, and if you fail it, then you are going to definitely spend another year in your fifth year and wait for the end of the year again to take this exam all over again. So what worked for me was study groups are very essential. Study groups are very essential. We all know that medicine is very broad, it is very extensive. There is no magic, there is no witchcraft that anybody is going to use to tell me that he was able to study all of medicine. There's no way. So forming a study group, like they always say, two heads are better than one. Forming a study group is going to make you to be immersed in the knowledge of other people, right? So your friends, your lecturers, your professors, you have to be constant discourse with everyone, right? Sharing and exchanging ideas, correcting your wrong ideas and emphasizing also on your correct ideas. Sharing your knowledge, it will help you to first of all consolidate the information in your head, and sometimes you might know a wrong thing and you might be so convinced that it's true until a lecturer or a friend or a classmate corrects you, and then it saves you, because this might be the only thing that saves you during your exam. You don't know where your exam will be tested, because you are in front of a myriad jury. You have pneumologists, you have cardiologists, you have neurologists in your jury, and they can literally take you anywhere during your examination. So you need to be prepared. After all, they are training you to be a general practitioner, right? This is an exam testing your skill to be a general practitioner. So you have to know a bit of everything. So being in a study group, and not just any study group, a study group that is dedicated, being with people that you know that they are going to push you and you're going to push them likewise. Not going to be in a study group where maybe you are with your friends and you could just sit and chat, and at the end of the day you don't work. That won't help. Also, now, because you also know that the exam is divided into two. You have your short cases and you have the long case. The short cases is 30% of the exam, while the long case is 70%. So you cannot ignore your short cases. So answering short cases is also key, especially in your study groups. You might answer short cases alone and you might get a lot of wrong answers, and you think that those answers are correct. But once you answer them together in a group, then you discuss ideas and you might see that some of your answers were wrong and you might get to correct them. And you can also help correct your mates' answers who might have thought maybe a certain answer was correct or wrong, because in short cases, it's either it's right or it's wrong. There's no in between. So when it's wrong, it's wrong. So you have to answer as many short cases as possible, and also you have to answer these short cases, because short cases, like they say, short cases, you answer them. It's like a flashcard kind of something. The question is brought to you, and you're expected to answer the question like in 5 minutes. So there is no time to be there thinking and trying to deduce or you have to just see the answer, and you have to just have the spot answer in your brain, and you're already writing down, because there is no time to sit and start reasoning. So what will help you is that you have answered lots and lots of short cases prior to the examination. You cannot go during the examination and start thinking and start figuring out things during. Nah, you won't make it. That 5 minutes is too short a time for you to be thinking about answers during your short case. You're just supposed to look at the board, and the answer is supposed to just flash in your head, and you're just supposed to write it. And that doesn't happen overnight. You have to study, you have to answer short cases over and over memorize them, answer them, understand, read, and continue reading. Do not give up, because during the preparation you can get discouraged, you can get depressed. And trust me, if you have gone through medical school, you have been depressed, you have been discouraged, you have been anxious at some point, don't give up. I know it's easier said than done, but don't give up. You also have to discuss the long cases with your friends. Now, during your examination, the long case, when you present your long case, you present from the entire history, you present your entire physical examination, you go to your diagnosis, your differential diagnosis, your investigations, your management, and your follow-up of the patient. All of these aspects of your history and your presentation will be tested. You have lecturers that will ask you questions on every single thing that you have put in your history. So you need to first of all collect and associate a good history, come up with good diagnosis, come up with good differentials, and come up with good ways in order to rule out these differentials. Come up with a good management plan, because you're a fit here, you're already a medical doctor. You want to see how well you can be able to manage your patients, because it doesn't just suffice to diagnose. Once you diagnose, okay, what next? This patient is not interested in your big diagnosis. This patient is interested in how well you're going to treat him or her, and how fast he or she is going to recover and bounce back to their regular lives. Patients are not interested in whatever medical stuff that you have come up with, but how well are you going to manage this patient? That's what the jury also wants to know. They want to know how well you are going to manage this patient. Now, when it comes to management, you also want to test your logical skill and your rational skill, right? Because there are things you read in the textbook of how well, maybe how you want to manage a certain case. There are standard protocols and standard procedures that you read in textbooks, right? And you master these procedures, and these are just standard ways. Now, logic and ration comes in place. They want to evaluate you on how well you take this knowledge from your textbooks and apply them to a real case scenario in front of you, right? A management plan might be structured, but now you have a patient with you who might not favor a particular, who might not be able to take a particular portion of a set management plan. You will not give that patient this management now because it's said in the textbook that this patient is supposed to receive this management, whereas this patient cannot take this management. You get so that is what they are trying to evaluate, right? They are trying to evaluate how well you can synthesize information and come up with a good way in order to manage your patient. And at the end of the day, if you are able to bring out these aspects, then you'll be successful. They don't want to see how well you can diagnose. They don't want to see how much information you have mastered or how much information you have crammed or all of that. No. Your logic, your ration, your clinical judgment, your clinical thinking, your chronology. Even if your diagnosis is wrong, how did you come up with that diagnosis? How did you arrive there? That is what they want to know. And if that reasoning is correct, then even if your diagnosis is wrong, everybody gets wrong diagnosis. That is a sure fact. Everybody gets wrong diagnosis. But even if your diagnosis is wrong and your clinical and logical thinking is intact, you're definitely going to make it during that examination. Anyways, this is where I stop. I hope this was very educative. I hope this helped someone out there. Stay blessed. Do not forget to like, subscribe, and share. Thank you.